Hey guys, so today I want to talk about lumbar laminectomy surgeries and recovery times. And so the big things that we're going to cover today is what that surgery looks like and feels like from a patient perspective. And so what are the things that you may be feeling before and after surgery, what that recovery time looks like. An important thing that we want to consider as well is how quickly can you get back to doing the things that you love. And so people are having surgery for a reason, is because they want to feel better and they want to be able to do more. So how long will you have to wait, and what things should you be considering before you get back to doing the things that you love? And so let's review the surgery, let's review the things that you may be feeling before the surgery and after the surgery, and then most importantly, let's talk about how quickly you can get back to doing the awesome things in your life. Here we go. So the first thing I want to talk about is the laminectomy itself. And so these are the things that I would be considering about the recovery time after a laminectomy. And so one is that it's a relatively minor surgery in regards to back surgeries and how they go. Like, not all back surgeries are created equal, and the laminectomy is one that is, I would call fairly benign. And I've seen a lot of people do it and a lot of people have great results. And that when you have the surgery, the recovery time isn't so much limited from soft tissue work, right? And so if you think of like a knee replacement, those people are really swollen and they've got a lot going on. They just did a bunch of hammering and they did a bunch of change to their biomechanics, and that you're recovering that, and it's long and it's painful. Well, I would say that's directly the opposite of laminectomy surgery, in that they go in, they remove a portion of the bone that's encroaching around the nerve to give you those signs and symptoms such as neurogenic claudication, which is that pain down your leg when you're trying to walk, and that you feel better when you sit down because you're opening up the space, and that when you close down on the space with arching backwards or extension, you have symptoms. And so that checks some of those boxes to do the laminectomy surgery, and they remove a portion of the bone around the nerve to help give you immediate nerve pain relief. And so when people are in their recovery of the lumbar laminectomy surgery, one thing that I always hear is that when they get up in the outpatient clinic or the hospital and they go to walk for the first time, the nerve pain is absolutely better. And so they don't necessarily believe me when I tell them that they may feel that before surgery, but when they feel that after surgery, they're really, really relieved. And then the next question they ask me is, how long is it going to take me to get back to doing the things that I want to do? And I will say, and if you look at the protocols, and in my experience, you should be able to do everything that you want to do in about 6 to 8 weeks. Now, the caveat to that is, how good is your body before, right? So how much strength and mobility do you have prior to surgery, and how much strength and mobility are you going to have to earn after surgery? And so we need to consider all of that stuff. But if you have a physical therapist look at you before surgery and kind of look at your spine and your body, it can give you a pretty good idea of what you would expect for outcomes as well. And so not all spine surgeries are created equally, in that some laminectomies are easier than others, and then not everybody's body is not created equal as well. And so there are some people who are going to do well with surgery and some people are going to need a little extra help. I don't know, there's like a bell curve. And so the biggest thing I can tell you is that 6 to 8 weeks in general, but some people sooner, some people later, just depending on how your body is prior to surgery. So if I were having surgery and I want to thinking about the recovery time, those are the things that I would be considering is, man, I've got 6 to 8 weeks to get to where I want to be. Who am I going to have help me to get me there? I know that the laminectomy surgery is going to help me with some of my leg pain, but my back pain may be sticking around a little bit, so I still need to work on that. And then I need to get walking, I need to get some strengthening going right away. And so just making sure you have a plan going in to help make sure your recovery is exactly what you're looking for, and you have the best chance possible to achieving those goals that you want to do, such as golf or play with your grandkids or whatever that may be. But those are things that I would be considering with the spinal stenosis surgery recovery time. So the next thing I want to talk about is back pain and leg pain. And so those are the typical, most common signs and symptoms related to spinal stenosis. And so before I go on to that, guys, if you want to give the channel some love and just share this video and just encourage people to absorb the content. This information is coming from nearly a decade of treating clients with spinal stenosis and other back conditions. And I'm a board certified orthopedic clinical specialist. Like, this is what I love to do. And so if you guys can just share the content, that would be awesome. But anyways, as I was saying, and so the thing that I would be considering with the spinal stenosis surgery, is the signs and symptoms that I'm feeling before and after surgery. So the category before surgery typically are people who have neurogenic claudication. And the biggest thing that people are getting treated when they have surgery is the leg pain. And so sometimes people think since you're having back surgery, back pain is the most limiting thing, but it's actually the nerve pain down the leg. And so if you have some encroachment around the nerve or something pressing on the nerve, causing leg pain, pain, that doesn't feel great. And that's the number one thing that people are treating before surgery. The number one thing that people are wanting to get treated when they have surgery. And so If the leg pain is limiting you from walking, right, that is usually a good prognostic factor for surgery, and that you may do better with surgery if you have that. And so if you're having the leg pain going into surgery and walking is difficult, I'm using that as an example because that's the most common thing, and that after surgery, what I would expect is that you're going to have some back achiness, right? They made an incision, they removed some bone, so you're having some healing in the bone and the tissue around it. But the leg pain is what's key, in that the leg pain feels really, really good after surgery. You may still have some residual stuff, but the intensity of that stuff reduces dramatically. I'm not saying it's all the way gone, but let's say your pain was a 7 out of 10, the nerve pain, burning, numbness, tingling down the leg, you have the surgery, I would suggest or guess that that's gonna be like a 3. Like you're gonna be, oh my gosh, significantly different, significantly better in intensity, and maybe you can even walk longer immediately before you have the signs and symptoms of the leg pain down the leg. And so that's a big thing, that big change that people see before and after surgery, in that leg pain feels a lot better. Now, if you have other symptoms such as back pain, well, you know, the back pain isn't necessarily the #1 focus of the laminectomy. It's to remove pressure off the nerve. It's not going to change your back pain, per se. So you're still going to have to work on improving your back pain, which comes from progressive loading, manual therapy, improving your mobility and range of motion, which I've done videos on many, many times in the channel. But you're going to want to work on the mobility and the range of motion still. And then if you have any leg weakness as well, and so if you have compression on the nerve for a long period of time, it's not uncommon to see some leg weakness. And so that leg weakness is going to take time as well, and that takes a lot more time than, let's say, the nerve pain itself. And so you're still going to be challenged with some of those areas that were uncomfortable for you or a challenge for you in the past, and that those things aren't going to disappear immediately. And so just set your expectation in that the leg pain is the #1 thing that people are looking for relief, and that the other stuff comes with time and continued work. And so you're not done working on your body yet. You still got to work on it. So those are the signs and symptoms that I would be thinking about before surgery, and that a lot of times my patients and I discuss before they have surgery. And what's really cool about what I do is I help them with their pre-op stuff. And so we're doing prehab, and we're bettering their body. I go with them to their spinal appointment to look at the areas, you know, of their back and talk with their surgeon of the best plan. Then we do sessions in between them having surgery, and then we get right after the recovery and surgery afterwards. And so that little bit of a tailored approach and that group approach I've been found to be very successful with, and people really, really enjoy it, to make sure they're doing everything they can to have the recovery that they want. And so just make sure you're finding something like that, because this is your back, this is your body, and you want to make sure you're giving it the best chance possible to a 100% recovery, and that the life and the goals that you want to achieve. And so I think that that's worth considering when you're thinking about the spinal surgery recovery stuff, and you want to know, okay, what's going to get better immediately, and what am I going to still have to work on? And so some of those things you're going to have to work on, such as the back pain and weakness, and the weakness in your leg or foot, if you have some of that, and just the overall core strength and mobility deficits. And the leg pain is something that you can kind of expect to have some immediate improvement in some way, shape, or form. Most oftentimes it's the intensity. Whew. So we went over a lot there, but we've still got something to consider here is, you know, how long is it going to take for you to get back to doing what you want? And what's that physical therapy like afterwards? What are you going to be doing? Let's talk about some of that stuff. All right, guys, so this is my bread and butter, right? The physical therapy after the laminectomy surgery. And so if you look at protocols are just something that doctors put together to help guide some of the recovery, and what should you be doing day 1, week 1 to week 6 to week 8. And so like I spoke to earlier, 6 to 8 weeks, you can kind of expect getting back to what you want to do. And some people that's pickleball, some people that's playing with their grandkids. It's different for everybody, and that's what makes this whole process fun. But then what you do in the meantime can be very structured or very loose. And I would say the biggest thing that I consider when I'm rehabbing clients after a laminectomy surgery is, what does that person look like in front of me? And so I've got the protocol to say, don't do this, don't do that, blah, 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 right? And then you see the person in front of you, and some people are doing very well in that they're able to do some of that stuff immediately. And some people need a little more TLC in that they may feel like they're behind, but they're not actually behind. And so that only comes from getting to know the individual in front of me. And so you just do a good self-reflection of your body. Like, did you take care of it prior? And so that's going to help your surgery and recovery time, or do you need a little bit of TLC because you haven't been able to do very much before surgery? In both of those situations, it's completely fine, but just understand that that recovery process is different for everybody. So don't compare your recovery to someone else's recovery, and don't compare theirs to what yours is going to be. So that's something I would consider with the physical therapy protocol afterwards. But in general, the things that you're going to be noticing and right away is that you're going to have some sort of lifting restriction, 20 pounds for some amount of weeks, just because they don't want to put extra pressure on the back, where they remove some of that bone. And then two, you're probably going to limit the amount of extension that you do, the standing up tall and arching your back or laying on your belly and pressing up. That's typically not the first things that we're working on, because those were the things that really bothered you before surgery. And we kind of have to earn that range of motion back, in that they remove the bone and they remove the pressure off the nerve, but they didn't magically give you more range of motion. And so everybody's range of motion tolerance is different. And so I typically don't have people arching back right away for a couple weeks. That said, we are doing a significant walking program. We are doing a significant amount of glute strengthening, whether it be laying on your back or standing. We're doing some cardiovascular work. We're doing a lot of arm strengthening. We're basically working everything around the back. And so when that tissue healing time kind of matches with that strengthening of your body, you just take off, right? Things just start feeling a lot better. We start with more straight plane movement first, such as bending forward, and then we move into rotation and then extension. And we want to regain as much of your spinal mobility as we can, because that's what's going to limit you in your daily life. So you need a certain amount of range of motion to bend over, to squat down, to reach up, to stand on a ladder, to do your golf swing, pickleball, whatever that may be. But as a physical therapist, we know what your goals are. We know what surgery you had, and we know what that recovery should look like and feel like to get you there. And so the protocol is there to help give us some guidance. But I would say it's been a long time since I've read a protocol, because it's about that person in front of me, what your goals are, what you looked like before surgery, what your nerve symptoms were like, what's your back pain like, what's your weakness like in your leg, if you have some of that stuff, and then where you want to be and what do we have to do to get there. So 6 to 8 weeks is a general rule for feeling a lot better. But sometimes you just got to scrap that, accept the person that's in front of you and see, okay, what does this person look like? And if we're answering those questions, your recovery is just going to be that much better. You're not a piece of paper. You're not just a machine that they removed apart. You should be better right away. You're a human being that had limitations before and after. Maybe you have some comorbidities. Maybe you have a little bit of obesity, or maybe you're doing awesome. Those recovery pathways are just different, and just accept that they're different, but just know that you are going to get better. 100% of people get better, and that better is just different than the way they felt before surgery. But the outcome is kind of, as much as you put into it, you get out of it. So don't get frustrated, just stick with it. But everybody's recovery process is different. For the physical therapy protocol is pretty standard. But just remember, if that physical therapist isn't necessarily following the protocol right to a T, it's because they care about you and who's in front of them, and they know what surgery that you had. They know where you want to be. Just kind of trust the process. Whew. Guys, I hope you guys enjoyed that video. Man, I love talking about this stuff. I've seen people do so well. But if I was able to answer some of those questions that you may have, or provide some clarity on some things, just leave a comment, engage in some discussion. I want to hear about your recovery before and after, and I want to hear about all the cool things that you're able to do. And so hope you guys enjoyed the content in the channel. As always, guys, show some love by sharing and subscribing, and just stay healthy, keep moving, and take care of that wonderful body.